Excited to have you all here today. Thanks for being here. It's my great pleasure to introduce Sherman Lee. Sherman began his political career as a member of the Roanoke City Council on July 1st, 2004, and has served the city since. Between 2008 and 2010, he held the position of vice mayor, and on May 3rd, 2016, he was elected mayor. During his tenure, Mr. Lee has served as the chairperson of the Personnel Committee, a member of the Audit and Legislative Committees. As a member of City Council, Mr. Lee formed the Domestic Violence Task Force in 2005 and began the annual Lee Youth Outdoor Basketball League and the Lee's High School Winter Classic Basketball Challenge in 2015. In addition to his service to the city, Mr. Lee is an associate minister as well as the founder and president of SP Lee & Associates, facilitating training sessions on topics including leadership, management theories and practices, and maintaining the skills needed to remain successful in our ever-changing work environment. It is my privilege to welcome Mayor Sherman to the stage. Thank you.
Good afternoon, everybody. Hey, all right, I'm pleased to be here. We had to come. Well, it looks like I've been on 64 and 81. The City Council has been involved in the Virginia Municipal League Conference in Hampton since last Saturday, and we finished up last night. I'm proud to say that my colleague on City Council, Anita Price, is now the statewide president of the Virginia Municipal League. So we're pleased with that. I'm pleased to be here on behalf of Roanoke City Council to welcome you to this special event showcasing the 2018 RAMP program cohort companies. And I'm real pleased to do it on behalf of my colleague. RAMP is a unique opportunity for aspiring entrepreneurs to learn to use their skills, their talents, and interests. Unlike other startup groups or programs in the region, RAMP is designed to provide startups with resources to help them grow and stay in the region, and that's so important. After seeing the presentation today, I think you all will agree RAMP's mission to propel high potential startup businesses to expand and create jobs in the STEM age is really being fulfilled. The City of Roanoke is proud to be one of the founding partners in this initiative, along with the Roanoke-Blacksburg Technology Council and Virginia Western Community College. We see RAMP as a valuable contribution to the future growth of Roanoke's business community, as well as other localities in our region. Most importantly, RAMP is a part of the future of the Innovation Corridor and the economic vitality of the city and the region. And that's important for us, and we're very proud and pleased with what's going on. So at this time, I'd like to introduce Carl Turrent from the Virginia Western Community College Foundation. Carl is coordinator of development at the Virginia Western Community College Educational Foundation, which is one of the founding partners of RAMP. She serves on the RAMP Advisory Board, is the property manager for the RAMP building, and administers the state and city grants that support RAMP's educational program. Please join me in welcoming Carl to this stage.
Thank you, Mayor Lee. Welcome, everybody. On behalf of Dr. Sandel, our college president, he could not be here today, but he wanted to make sure you all felt welcome and understood that I could communicate his strong support for this project. He is all in, and you all know if you've talked to him that he loves what RAMP is about, and he loves that the college can support young entrepreneurs who can hopefully go on and start businesses and employ our students. So it's really critical to us. So you saw across the street as you came in, we have a new STEM building that's going to open up in fall of 2019. So I hope you come back next year and include a tour of that building as part of next year's demo day. Okay? So have a great evening, and thank you. Next up.
With that, I'll ask our director, Mary Miller, to come out.
I just want to say welcome to all of you. This is a fun day for us. A lot of work goes into getting here. This is the second time we've done a demo day with our accelerator program. It's simply our second cohort. A couple of members of the first cohort are in the audience. I'd like them to stand. You'd be pleased to know that all of our companies that finished the first cohort are doing well, and they all couldn't be with us today, but I do see Josh with AFT. I know Ed Champion's here somewhere with Altede in the back. I know Sammy Lamouy is here with Alcohol Research, and so and there's Paul, and there's all kinds of good people. The reality is it's family, and part of what we're doing is building a community that continues to grow and help one another. Today, you're going to see 7 presentations. We're not finished. We're moving forward. This cohort, this is their public presentation. They'll be interested to meet with you afterwards at a reception next door and to learn more about them. We've mentioned our founding partners. We couldn't do what we do. We're just one little piece of it. And of course, our sponsors. A number of representatives from our sponsors are in the audience. If you would stand briefly for me, I'd like the audience to recognize there are people all over the region that make this financially possible. We couldn't do what we do without that kind of support. So I can't thank you enough, not just for your presence to be here today, but dollars sometimes matter. So I thank you a great deal. I'm going to step off the stage so I can be backstage with the presenters, and I think we're going to be ready. Each presenter will be introduced by their mentor, and I'd like Kevin Bloomfield to come to the stage. Kevin, I'm going this way. It's all yours. No, you can have you got it.
And I'm going to ask you to use that because I need this.
Okay, good. So hello, everyone. Maybe I don't need everything. I'm excited to introduce Mark Lanoff for Healthy eScores, but before I ask him to come out, I do want to point out something that's really unique about him. All of us here in the audience, and many of us who are longtime supporters of RAMP, get excited about the success stories, and that's one of the reasons that motivated us to really work on an accelerator. Well, the reality is that everybody can't be a success, and while we cheer success, we also cheer quick failures. I was an entrepreneur, failed many times early on, didn't have a resource such as RAMP to help me fail faster, so I spent too much time, way too much money. So I'm going to introduce a really dynamic, future successful entrepreneur who had a really good idea that we were excited about. We challenged him on his idea, he worked through the idea, and the idea failed. And he decided to pivot, and he's working on some different ideas. Many of us who focused on RAMP early on were tired of really dynamic young entrepreneurs who had good ideas and good potential, who would fly the coop and go to Austin or San Francisco or any other important accelerator to leave our region. Well, Mark is an example of someone who stayed in the region because we had RAMP. He is now getting deeply embedded through his connections through this program, and I'm excited about what he will become in the future and the chance that we now have as a region to retain Mark. So without further ado, I'll introduce Mark Lanoff with Healthy eScores.
Thanks, Kevin. Good afternoon, ladies and gentlemen. My name is Mark Lanoff, and I want to thank you for the opportunity to share my story with you all today. Special thanks to Mary Miller, my mentor, Kevin Bloomfield, RBTC, and the entire Roanoke-Blacksburg community. I also want to thank my peers in this cohort for being fabulous support friends and future friends as well. I've learned a lot about myself during this RAMP journey, what it takes to start a business, and how to be okay when things don't always go as planned. This is me. a 26-year-old entrepreneur and philanthropist from Northern Virginia. This is where I went to college, and this is what I studied. Nothing to do with healthcare, nothing to do with healthcare technology, and certainly no formal business training. This was the first job I had after college, which I obtained from a gentleman who I met on an airplane who happened to like our conversation, funneling me into the healthcare industry ever since. These are all the jobs I've had since that first job 3 years ago, all of which led me here, founder and CEO of Healthy Scores. As former director of clinical services at Bradley Free Clinic, part of my job was to distribute, collect, and analyze patient satisfaction surveys for our clinic manually. This took time and energy away from other projects. So I started Healthy Scores and applied to RAMP, hoping to build a real-time patient experience survey tool that could be used on any mobile tablet device in any patient checkout window in outpatient medical facilities. But unlike the companies you'll hear from today, this is a business I decided not to see through. My mission was an altruistic one. I wanted to put patient experience data into the hands of these agencies to improve operational decision-making and strategic planning, so that hardworking, low-income, underserved individuals like Ms. Gomez from Salem or Mr. Howard, who lived here in Leland, Mississippi, could play a more active role and have a more meaningful voice in improving care quality at facilities like these. Rural health clinics, federally qualified health centers, community health centers, free and charitable clinics, Veterans Affairs clinics, and rural hospitals. Arguably the healthcare stakeholders that are bearing the heaviest weight in providing healthcare services to our nation's underserved. And I thought we had clinics like Bradley Free Clinic and Leland Medical Clinic, and I thought we had identified an incredible niche in this marketplace, one that was large enough to grow our business and sustain our business development, but small enough that we wouldn't be impeding on large healthcare surveyors like Press Ganey or the advisory board. And I came into RAMP soaring with confidence. I thought that all it would take was $100,000 to build our sales team and develop our software to take over this market. Pretty naive. We had raised a little over $10,000 from individual contributions, friends, family, and fools, as James Rainey likes to put it. And again, soaring with confidence. But the ongoing coursework and mentorship provided through RAMP challenged me to do two things. First, eliminate my confirmation bias, swallow my pride, and take a step back from the problem at hand, not taking a solutions-driven approach, so that we could learn as much as we could about the market we were approaching through extensive customer discovery. And that's what I did. Nearly 100 interviews with executive directors, CEOs, COOs, VPs of finance, revenue cycle specialists, billing specialists, nurses, doctors, you name it in the healthcare industry, I spoke with them. And I uncovered 3 discouraging truths. First, our small niche market had very few buyers, if any. Patient experience surveying wouldn't yield immediate ROI, and we knew that coming into RAMP. Small healthcare stakeholders, particularly in rural areas, were struggling so much to meet their bottom line that they likely wouldn't invest in products that wouldn't yield ROI within 6 to 12 months, a very small window. So a rural clinic in Mississippi might pay for expensive telemedicine equipment, but they were unwilling to invest in the theoretical gains from strategic planning. Second, the regulatory environment around healthcare surveying made it very difficult to change survey culture. Large healthcare systems, like Carillion or Lewis Gale, measure the patient experience and clinical care quality using CAHPS, the Consumer Assessment for Health Providers and Services. This is a paper and telephone-based survey tool that's submitted directly to CMS, the Centers for Medicare and Medicaid Services, and can actually yield a higher reimbursement payout for those facilities based off of quality scores. However, federally qualified health centers, rural health clinics, and inherently free and charitable clinics are ineligible for those same payouts. Thus, there's no federally backed financial incentive to measure patient satisfaction or to measure care quality in those facilities. Third, and most importantly, patient experience wasn't top of mind. In nearly 100 conversations I had with individuals in this industry, not only was patient experience not top of mind, it never came up in conversation. It wasn't important to people. But RAMP didn't just allow me to uncover why my business wouldn't work. It allowed me to uncover a laundry list of issues that clinics still face across the nation that are needing to be solved, and that I plan to conduct further investigation and research to try to solve. Issues like nurse turnover, which costs clinics and hospitals millions a year, or internet connectivity, which prevents rural clinics who spend lots of money on telemedicine equipment from using that expensive equipment in the first place. Vaccine storage, which I discovered spoiled vaccines is one of the highest cost items for rural clinics. Patient collections, and more. And without RAMP, I wouldn't have uncovered any of these things. I would have continued on a very narrow path, driven by my own pride and lack of technical training, building a product that no one wanted. And I would have been $100,000 in the hole. But instead, I likely saved years of time and about $90,000. And I built authentic relationships, not only with individuals here in the Valley who are willing to provide me guidance and constructive criticism, but also with healthcare leadership across the nation, in some cases, who were very accepting and grateful for having someone come into their facility and ask them questions that no one had asked them before. What hurts the most? What do you actually need? And those are relationships that are invaluable, that I know 10, 15, 20 years from now, I can call on those people to provide me guidance and potentially even future investment. I also learned to invest in myself. I learned to be intellectually honest about what I do and do not know in this industry, and to seek out opportunities to gain the technical skills I lack so that I continue my tenure in this industry and be successful as a leader in healthcare. So I've decided to go back to school and earn my Master's of Health Administration next year. That's about $70,000. If anyone wants to invest in me personally, we can talk during the reception. Last but not least, I learned to love Roanoke. I moved here last July to work for the Free Clinic, and admittedly, I was skeptical. Being from Northern Virginia, I was used to the hustle and bustle. Having spent much time in Mississippi and Memphis, I was very used to deep Southern hospitality. I was unsure as how I'd fit in. And it really wasn't until I joined RAMP this May that I firmly believed that this could be a place that I could raise my future family. That was a place that I could invest my future dollars and start my future businesses because of the amazing business community that's here, that's supportive of one another, that's passionate about making Roanoke a hot city in Virginia, which it should and will be. And for all of those reasons, I'm eternally grateful. Thank you so much for the opportunity again to share. You'll hear from some amazing companies today. Again, thank you.
Thank you, Mark. Next up is Constructability 3D, and I would like to ask their mentor, Greg Feldman, to please come up on the stage.
Thank you, Robert. And I'd also like to ask Chris Moore and Jeff McCarty to join me quickly. The fact that there were 3 mentors here is a reflection of how needy I was. But this was a little bit of a trial. We did a team experiment here, and Jeff and Chris, this was their first time serving as a mentor, and I think it worked out to be a very powerful equation because of their business experience and backgrounds and expertises brought so much more to the table, and I think John would agree with that. So on behalf of all 3 of us, I would like to introduce John Brock, the founder of Constructability 3D. John had about a 25-year career as a custom home high-end builder, primarily in and around Smith Mountain Lake. And during that time, he gained insights into the kinds of problems that can exist when a builder is presented with 2D drawings that is then turned over to the field to go produce, and trusses come in that are mismeasured, or the foundation is off a little bit, or the hole we thought we were cutting for the plumbing can't be done there because you would not have the support. All of that ends up creating pain and agony not only for the builder and potential cost overruns, but also the friction that it can create between the builder and their end client. And as John would tell you, your reputation is everything. So he's come up and used technology to really virtually pre-construct high-end custom homes to avoid all this pain and heartache, and I think you'll really enjoy the presentation. John, where are you? Or maybe you're already here. Oh.
Come on, John. You're so tired. You got scared of it.
Well, thank you, Greg. Again, my name is John Brock with Constructability 3D, a tech-enabled 3D modeling and constructability service for the construction industry. So constructability is a project management technique to review construction processes from start to finish during pre-construction phase. It is to identify obstacles before a project is built to reduce or eliminate errors, delays, and cost overruns. So we don't live in a two-dimensional black and white world, but to this day, builders still receive 2D black and white drawings to build from. The lack or the absence of the third dimension often leads or results to construction or design mistakes or omissions that go largely undetected until it's too late, which ultimately leads to delays, cost overruns, and statistically 50% of change orders. There's also a lot of other collaborators involved in the process. There's other professionals. They too provide their 2D drawings and specifications for the same project. So I graduated from Virginia Tech with a degree in engineering and started a custom home and design build business that I've been in for 25 years at Smith Mountain Lake. Over these years, I've become an expert at 3D modeling of every aspect of the construction process, so I can show my clients and my team exactly what the project's going to look like before we ever break ground. I also developed several proprietary software extensions, which enable us to speed up our workflow, but also to produce accurate lists of materials and labor. I use the models to create working drawings and ultimately very photorealistic renderings for the project. Now this stuff is really cool, but the reality is most builders do not have access to anything remotely close to this. Excuse me. So many of you here probably belong to a peer group in your industry. For the last 10 years, I've been involved in a Builder 20 club through the National Association of Home Builders. And as the name implies, each club has around 20 members, and there's about 30 clubs around the country. My club has 19 of us from here to Seattle. These guys are all high-end home builders. Most of them are doing between 5 and 15 million a year. And we get together twice a year to meet at a member location where we share and learn from each other's collective experiences to be more profitable. And over the years, I've heard nightmare stories of projects that have gone upside down due to losses and delays and so forth, and eating up their profits. Now, over the years, I'm the only one that uses this 3D technology, and I've been hearing for a while, John, this stuff is really cool. I love these animations and stuff, but are you making any money at it? You know? And that was until one meeting during my update where I showed them a 3D model and a constructability review for a project that I was bidding on at the lake. Using these 2D models or 2D drawings, I bring them to life in these detailed 3D models that I can view the angles from any angle. And come on, change. And so the guys in my group were intrigued by that because in the first 5 minutes of me showing that, I pointed out where I had identified $10,000 in mistakes before I even signed a contract with them, and that had their attention. By the end of the day, I had 10 plans in my inbox from some of these guys. For example, Victor Myers is a builder in Dallas. He was getting ready to start a 9,000 square foot house and hired me to model and review the project before he got started. I found dozens of discrepancies between the architect's plans and the structural engineer's plans and a major design flaw in the foundation. Vic paid $5,000 for that review and later told me that my findings saved him $25,000. That was a 4-to-1 return on his investment. Another example is Paul Clark. Paul's company does $8 to $10 million building high-end homes outside of Salt Lake or outside of Park City, Utah. Does $8 to $10 million a year. Paul told me that every year they experience 1 to 2% margin slippage due to these kind of mistakes. That's over $100,000 a year in lost revenue due to these kind of things. So he hired me to take a look at one of his new projects that he was getting ready to start. Among a lot of issues, I immediately found a roof issue. Now this is the 2D truss layout that he was given. This is what it looks like when I imported the roof trusses from the manufacturer and put them into the model. The entire center section of the house was 2.5 feet taller than the front and back timber frame porches that it was supposed to align with. What had happened was the architect had included this, detail showing a stepped up roof or ceiling in the great room, and it looked fine to me. But the engineer had included an expensive girder truss running from front to back, and then turned the other trusses side to side up on top of that wall height to get the ceiling height that he needed, which bumped the whole thing up. So I reached back out to the truss manufacturer and I said, "Can this be done?" He said, "Sure." They sent me the final model, everything fit perfectly. Now, in reality, the corrected order was actually $3,500 less than the order he was getting ready to sign. Plus, Paul's company avoided a 3-week delay and a $15,000 hit on this one item alone. Maybe more important again is that he did not have to tell his client about this delay or the pain of that experience. I was so excited in the successes that I was seeing with this that I decided to halt my construction projects and focus 100% on building my constructability business so that I could help builders like them across the country to be more profitable. To date, I've worked for over a dozen builders who have had the similar results. So we now have repeat clients who appreciate this service and value this service, and they actually include it as a line item in their budgets. And they show this as a sales tool for their clients where they can show them how this service and this system will improve the process and save money. Our initial target market is mid-career high-end builders, like the guys that I showed you in those slides, that want this technology. They typically build about 3 to 6 homes per year. An average home might look like a 4,000 square foot house at $250 a square foot or about $1 million, but that varies a lot across the country. The business model is technicians would generate the 3D models, averaging 1 project per week. Project managers would review these models and generate constructability reviews for the clients. The fee is based on square footage, which builders understand. It's about $1 per square foot under roof. A single technician, approximately $60K a year, should be able to produce about 50 projects a year, which would service about 15 to 25 builders per year and generate revenue at about 180 to 200K per tech. What we deliver is the 3D model itself, which we host and our clients have access to during construction. We have the constructability reviews, which is the detailed report of our findings. We give them the detailed list of materials, which is accurate right off of the model. We also, probably more importantly, deliver peace of mind and improved efficiency for them. So our initial go-to-market, this unique group, actually our target market coincides with these guys in the group, the 20 Club. So what we're going to do in phase 1 is get out in front of all 30 clubs and these 500 members. I'm already an official speaker on the roster, and I know this demographic very well. So I'm reaching out to them for speaking engagements to get in front of them to help build our client pool. Phase 2 would be to getting out the rest of the 12,000 custom home builders in the National Association of Home Builders. Our competition, if you were to search the constructability space, there's some national providers that were shown, but they all focus on commercial construction, where our niche is custom home builders. On my team, on my advisory board, I have a Canadian architect and fellow 3D modeler, as well as a local computer programmer who developed 4 products for us that we use in our workflow. Financial projections, 2018 was spent building this business, developing 4 software extensions, and 12 builder clients, and projecting about $100,000 in revenue this year, getting it started. In 2019, I'd like to hire 2 technicians and office support. There's going to be a lot of training involved in that, but we hope to reach $500,000 in the first year and hopefully up to 35 builders. 2020, efficiency should be in action with the current staff that we have, hopefully reach up to 48 builders and a target revenue of over $800,000. By 2021, I'd like to hire another technician and a project manager who can enter my role as a builder liaison so I can focus on sales and operations. Hopefully a target revenue of $1 million a year, third year. Our current status is the software is completed and we're ready to sell products. We have 12 pilot builder clients with high stickiness. Hopefully we're doing $100,000 in gross revenue this year. So the fire is lit. Our initial sales and marketing efforts are underway. So our ask is to pour some gas on the fire. Constructability 3D needs a runway of 24 months to capture the market, somewhere between $250,000 and $350,000. And with that, I want to thank Greg and Chris and Jeff, who've been incredible mentors to me, and Mary and all my fellow cohorts. And thanks for this opportunity. Any questions?
I'm going to ask you to stay out here a second. Does anybody have any questions for John?
That was easy.
Going once? Okay.
Yes, ma'am.
Do you see any of the commercial competitors getting into the custom home building space?
I haven't seen that. I think there's so much focus on, they've got plenty of work to be doing. It's a different space altogether, I think. Yes, ma'am.
Where are you with software? Do you have already built patented? Where are you doing with that?
The software that I use for the 3D modeling is called SketchUp. It's an existing product. 35 million people use it. The products that I've developed for it are for sale nationwide, or across the world. I've got lots of customers already. I have an estimating program that I've developed, a framing extension I've developed, and two other products. So those are my products, but they're used in my workflow. They were all designed to work in the workflow, but their extensions commonly available. No, other than I own the 4 different products. Yeah. Anything else? Yes, sir.
You mentioned peace of mind.
Yes.
You talked about material lists, whatnot, do you have any liability if material lists are incorrect? Or
That's a big old disclaimer that Ford Kemper in here somewhere. I have it. I mean, it's just like the issues that I find. If I find 11 issues and there was 12, hey, I found 11 issues for you. So we have disclaimers about that, and also the materials. It's clearly stated this is what's inside the model. If it says 937 studs and you ordered 937, had to go back and get 50. I don't know who cut up what and did things. It's just, even like the house that was on the cover slide. The builder told the architect that I did that work for that I did a whole separate drywall amount for him. And when he totaled it all up, he took my number, and the guy that gave him a quote was 40% higher than what mine said it should be, which he took that to the drywall guys. They cut their price because he ordered what I said to order. It was 40% of his budget right there. So now he tells they think he's doing that every single time, even though it was at one project. Any other questions? Yes, sir. Great question. And as far as ramp with customer discovery, that was obviously one of my targets was architects. And a lot of architects will use the 3D modeling, but most of it is in-house and for visualization. They don't give these models, most do not give these models to the clients for fear of liability or misinterpretation. And really, to be honest with you, the 2D stuff, it's here to stay because it's get in, get out, get to the next job. They don't have time to spend on that. And so the builder is left to cobble together all these drawings and try to make sense of it all. And that's where these problems happen. They happen on every house experiencing these issues. Yes, sir.
Now, you did a pilot with the 3 companies you mentioned. What percentage of their projects do you anticipate adding the service to next year?
Those 3 are on board with me for every project. But I have to admit some bias, they're in my group. I've known these guys for 10 years. So now the trick is getting in front of all these other groups. But yeah, I just got back from Memphis 2 weeks ago for our meeting there, and one of the guys asked for a show of hands who uses John's services, and well over half of the group raised their hands. Who will continue to? Same people raised their hands. Who will in the future? We had 2 new guys that just joined the group that raised their hands. So it's still a learning curve. We're still trying to perfect it, but it's proven to be successful. Thank you. Yes, sir.
What do you figure the training time is for the technicians that are looking to take over some of what you're doing now and or build produce for them?
Yeah, it's gonna take several months of intensive training, and it's gonna be me producing most of that revenue at first. But the grunt work with the products that I've developed, like the framing plug-in and things like that, I could easily train that. But I have to put my eyes on it. I've been building for 30 years, and I know what I'm looking at, whether it's gonna work or not. So finding that person to step in would be the next chore. But when you could take an actual construction project manager, they don't have to know how to get around. They just have to get around in it, but they'll know what their C is wrong. So there's easily a way to tap into that market.
You might mention that you found that here at the college and in the general market, people that experience SketchUp training.
Oh, yeah. Well, I've actually already got 2 fully trained technicians in Canada that I could call on at any time. I want to build that here. They're ready to go, ready to roll. They use my programs. They've taken my courses and that sort of thing. So I already have guys that I can use for an overflow now, but I want to build it here. Anything else? Yes.
Do you know if any of their clients needed financing options? And if they did, did it expedite the construction process?
Haven't heard that one yet. These are typically, on the high-end bit where they've got all their financing secured. That's a good question, though.
Okay, thank you.
Thank you very much.
Thank you, John. I'm going to let the next mentor speak for himself.
First, I want to thank the Academy, and I'm sorry I could not be there in person to accept the Oscar, but I'm filming on location. Oops, wrong speech. Hi, I'm Bart Wilner. On Tuesday, May 22nd, I received a call from Mary Miller inviting me to something called Mentor Madness. 2 hours later, I was at the Ramp building attending Mentor Madness. That night, I learned a lot about Ramp, their accelerator program, and their emphasis on entrepreneurship, education, connectivity, and support. I learned what a cohort is, and I met the 8 members of the 2018 cohort. As a result of Mentor Madness, I was selected to mentor Elizabeth Jose of Fluid Capital. In the past 4 months and over many, many meetings, I have learned much about Elizabeth Jose, about Fluid Capital, about immigrants, and about the challenge immigrants have moving money like this around the globe. It has been fun and a wonderful experience assisting Elizabeth on her journey to develop Fluid Capital. Ironically, I think I've learned more from Elizabeth than she has from me. Ladies and gentlemen, it is my distinct honor and pleasure to introduce to you my new best friend and to someone who's going to change the world, Elizabeth Jose. Take it away.
Hello, everybody. I'm Elizabeth Jose, CEO and founder of Fluid Capital. Now, you may be surprised to hear this, but I wasn't born here. I know, big surprise. I was actually born in Kerala, India, and from there, when I was 4 years old, I moved to Zambia, and from Zambia, I moved to Fort Lauderdale, Florida. And in fact, this is a picture in 1997 that my mother took of my father and my sisters and myself. I'm the one in the back, on the famous beaches of Fort Lauderdale shortly after we arrived. Now, before we move on, I'd like your help to demonstrate a discovery I made as an immigrant traveling through the world, and also just as a traveler in my adult life. And that's the difficulty in moving money around. Now, you all received these pins before you came in. Now would be the time to actually turn them on and put them on. Now, the reality is there are many immigrants such as myself all over the world, and there's lots of money being moved by these people. In fact, right now, we've essentially populated what I'm going to see as the world for this period of time with money. And the amount of money immigrants are moving every year is $613 billion. Now, in my pocket here, I have the equivalent of about $80. Now, let's say this here is South America, North America. Over there, you guys are Europe, Africa, Asia, and Australia. You're pretty small, Australia, and I'll be Antarctica. Now, if I take this $80 and I want to toss it over to South America, great catch, it seems pretty simple. Now, South America, how about you get it over there to Europe? Not bad, not bad. But you see, sometimes things get lost in that shift. You got lucky, you actually found it. Now, let's see if you can make it over to, where do you want to go? Australia? That's over there, I know. It doesn't seem so easy anymore. Exactly. Now, whoever's lucky will get that later. But the reality is that this movement of money is fraught with challenges far beyond just regulations and restrictions within each jurisdiction. And from our research, we have found that accessibility is one of the biggest ones. For immigrants, language barriers, proximity, having to walk so far just to get to a place where you can get that cash when you so desperately need it, is a difficulty. Not understanding the language of the systems in the country that you're in is a major challenge. Beyond that, I can send money today to India with relative ease compared with any person in India trying to support me here today. Or in 1997 when we could have used it. And then there's the long wait times. You're often lucky if a transaction happens in 3 days. And even luckier if it happens in 24 hours when you're talking about global transfers. And usually, making that happen so quickly comes with an additional cost. It's fun and it's easy to move it from South America over to Europe over there, but reality, if you wanted that to happen so quickly, you're looking at probably about $40 or more just to make it happen. So you've already only got $40 there. Security is, of course, a concern. When you're handling cash, when you're moving this money around, there's always the risk that something's going to get lost. Somewhere it'll land and you'll have no idea where it actually is. And last but certainly not least is the cost of transactions. Now, I already mentioned the cost of making that happen so quickly for you, but with every transaction, globally, the average fee is 7.2% of what you're sending. And in areas such as sub-Saharan Africa, it's about 10% higher than anywhere else in the world. So, what are we doing? We're trying to fix this problem. Fluid Capital is using blockchain technology to provide an accessible, efficient, and economical way for people to access and use their money regardless of geographical location. And we're not going to do the whole world right away. We do have a go-to-market strategy, and that focuses on the two regions we know best, South and Southeast Asia and Sub-Saharan Africa. Those regions alone, the immigrants from those regions move $161 billion every year. Now, we will further focus on the US because we happen to be here. Now, from immigrants in the US from these two regions move $43.5 billion. Now, let's talk about these people. That's 7.7 million immigrants from South and Southeast Asia and 1.7 million immigrants from Sub-Saharan Africa. Now, I want to point out at this point that my statistics will focus on the immigrant populations from these regions that are handling remittances in particular. There are two other major groups that will immediately be able to access and use our system. That's the 1.1 million international students that enter the US every year and the 75.1 million tourists that enter the US every year. Now, to recap, these populations do happen to fall into certain concentrated areas, and we're not going to go after everyone all at once. By focusing in and researching on the concentrations of these populations, our initial target is 1.4 million immigrants from these two regions that move about $6.5 billion every year. How do we do this? It's pretty simple, and that's the way we like it. You simply make an account with Fluid, you load your wallet with money, and you select your recipient and the amount to send, and you send it. Beautiful. Just like that. That's if I were to send something to India right now. And this is how we want our user interface to work, to be compatible, easy, and efficient. But let's take a closer look at what we as Fluid are really doing here. Fluid has multiple people operating within it. We have people and we have businesses. And we allow them within our network to interact in a decentralized manner. On the exterior of our system, we have regulatory bodies, financial institutions, and Fluid manages the interactions with those so that our users have the optimal experience. Now, in this situation, you must wonder, how can we really simplify it to a degree that we can actually reduce costs? Where are we making money? The reality is that by using this technology, we are able to reduce the processes and the complexity of some of these processes while offering the same level of security. And so that gives us revenue from 3 different spaces. When we're holding large amounts of money from our users in accounts while they're within our network, we're actually earning interest and investment returns on that. Furthermore, as we include more businesses into our network, we have revenue coming from our business-to-business relations because we are charging fees. They won't be comparable to the current fees that businesses have with banks and credit cards, but we will still be charging fees. And last, with the global peer-to-peer transfers, we will also charge fees, significantly lower than the international standards of 7.2 and 9.4 in sub-Saharan Africa, but fees nonetheless. You will notice in this that all of these sectors actually grow at different rates, and that's because of our plan for when we go to market with specific elements and features of our product. Of course, competitors also exist in this space, and we would be fools to pretend we're alone here. But what I'd like to point out in this space is that we are actually dealing with perceived competitors. Our focus is on a group of people that are underserved by these institutions. These institutions don't offer the language accessibility. They don't offer the service in a lot of the regions where these people need it the most. And they don't offer the low-cost solution or the simple app. So we actually are perceived competitors in most of this space, and we don't actually directly compete with all of them, especially in our early stages. As we grow, they become greater competitors. And you'll notice there's one place where we don't actually match up entirely, and that's in that we don't charge a currency exchange premium. And in my opinion, I'm proud of that. So we've been a company for 4 years now. What have we been doing? This is a heavily regulated industry. We would be foolish to step forward and say we're going to do this without having done our research. We have built relationships with regulatory bodies domestically as well as internationally so that we know that our steps moving forward can actually happen. Beyond that, we've looked at all the compliance measures, we've mapped out our trajectory appropriately, and we've derived a method for value stability which allows us to offer the lack of currency exchange premiums. It allows our system to actually retain stability in a way fiat currencies and other commodities cannot. Furthermore, we have validated our research with numerous interviews, over 200, just in the past couple months, and we're working currently on provisional patents. Moving forward, we have plans to begin our beta development now by the end of this month, and then move forward in 2019 with the formal launch of a domestic business-to-consumer, which would be the domestic peer-to-peer system, followed by domestic business-to-business, where we introduce the businesses, and lastly, our global in our 3rd and 4th quarter. You'll notice the black numbers, the numbers in black that are indicative of where we need funding along the way. The 500,000 at the end is actually because we can move that to be in the 3rd quarter and therefore have the licenses to operate in all 53 states before we're actually having clear operations in all those spaces. So that's an if we want. But most of this funding covers the development, human resources, licensing, and legal and compliance, of course. We have been lucky to have numerous people behind us in this journey, and I myself have a lot of experience in business, both internationally and domestically. Raisha Kasaju has been absolutely vital as a financial consultant and is VP at Citibank in Manhattan. Manoj Padil will be our head of operations in South and Southeast Asia. He's an entrepreneur himself and also worked in the government and legal space and in general business operations within India and several other countries in Southeast Asia, the Middle East, and also in Africa. We necessarily have legal counsel both internationally and domestically, and we have been fortunate to work through RAMP and have the support of RBTC, and it has been a wonderful journey so far. I am glad to have had the opportunity to introduce you all to Fluid Capital. Thank you, and you can keep the money.
Do we have any questions for Elizabeth?
Yes.
How are you going to address the issue specifically transportation? So sure, I spend money every month of the digital money fiat issue because it's a large amount of population in investing.
Yes. So a lot of our focus is not just on the unbanked. Actually, there are a lot with banked. And the thing is that most people do have either a cell phone or a desktop, which is how you can access our system. You don't need to have access to the unbanked. And when we enter into the global space, we have strategies to work within those populations and businesses that are already in existence there. But to get into the full details of that would be a little complex, but we do have relationships with businesses and regulatory bodies and banks also in those areas that help to facilitate those, even when there is cash involved and not just the digital form of payment. But when you look at, if you're familiar with the area, you've seen the success of companies like M-Pesa, for instance, and that's because it relies on this digital system of exchange. And so we would mimic that in certain ways and even partner to a certain degree with other groups that are trying to do that already in that space. Do we make our money? So we are holding a lot of that money in bank accounts, especially in the early stage. And so from that, we have a specialty account. We've already got contracts with banks and everything else to ensure that we have a specialty account where we actually get a significant amount more in revenue and investment return from those funds that are sitting in an account. So that's one significant space of revenue right off the bat as soon as we start having users and launch our system. Now, beyond that, as we start introducing businesses within the Fluid network, we would be charging them a fee to be utilizing our services and processing the transactions because we'll actually be providing them a little more in terms of services similar to a payment processor, but not quite. And then last, when it comes to the transactions that people are making in the global space of sending remittances, though our fees are not as high as what they have as the international averages that I mentioned of 7.2%, we still have fees for that because there is an expense on our end and we need to make sure that we're charging a little beyond that so that we can continue working and have a profit. Yes? I'm glad you asked. We've spent a lot of time on that. So we have lists upon lists of regulations that we have to be aware of and policies that we need to have in our books, not just for the US, but every other country we'll be interacting with. And we also have built into our system and the way it's developed that as soon as certain amounts of money trigger an alarm because of limits that have been hit, especially depending on where it's moving from, then it'll prompt for increased information or even notification that this won't be possible due to the regulations in those spaces. So we absolutely have that built in. We're not looking to be shut down on our first day. So
Okay, thank you, Elizabeth. Next, I'd like to invite Cynthia Lawrence up to introduce Beam Diagnostics.
Thank you. I'm excited to introduce Sarah Snyder and Beam Diagnostics. Let me position Beam and its importance for you. I think this is going to be significant as you listen to her presentation. First of all, bear in mind, and most of us know this, that addiction is expensive. It costs our society and businesses and families a lot of money and a lot of heartache at times. Beam Diagnostics has a tool that can accurately predict individuals' predisposition to addictive or risky behavior. So you'll hear all about that from Sarah. But a little bit about Sarah. She is a postdoctoral fellow in Dr. Warren Bickle's lab at VTCRI, the Research Institute, and that in and of itself is not a small accomplishment. She is a very capable and accomplished young woman. And I asked her, in preparation for this, how she came to be the CEO of this spin-out company from Dr. Bickle's lab. And she described Warren Bickle as the big idea guy, and herself as the person that operationalizes a lot of those visions. And then she herself has lots of aspirations and visions around the work that they do. She also has some aspirations around business, things beyond academia. So I said to her, well, as a young person or as a child, were you interested? Did you ever see yourself in business? And she said, well, you know, when I was little, all the kids in our neighborhood would get together and we would play town with Monopoly money. So what they did, in essence, was take the game of Monopoly in concept and they would set it up physically around town, and everybody's house was a business or a stop, and they would take the Monopoly money and they would conduct transactions. So in that way, Sarah operationalized Monopoly. My prediction is that Beam Diagnostics, under Sarah's leadership, will actually become a monopoly in all the positive senses of the word in predicting addictive behavior, and therefore helping society and businesses and families solve one of our biggest problems, and that is the correction of some of these destructive, addictive behaviors. Sarah.
Thank you, Cynthia, and thank you all for being here. My name is Sarah Snyder, and I'm CEO of Beam Diagnostics, and today we're going to be talking about our product, Beacon, which is a mobile tablet application for use by physicians in the clinic to predict the risk for alcohol use disorder. Of the 15.1 million people in the U.S. with alcohol use disorder, only 8 out of every 100 individuals actually receives treatment. This is a huge problem. As one of the nation's leading causes of preventable death, we have to increase this rate of treatment. One way to do that is to increase the standardized screening rates in the clinic. However, of the 180 million adults who reported using alcohol in the past 30 days, only 13% of them were actually screened for alcohol misuse in the clinic. Why is this the case? Well, Think about when you go to the doctor. You're almost always asked a single question about how often you use alcohol. Everybody lies or bends the truth. Not only that, but your doctor's not motivated to follow up with you using a lengthy, standardized screening interview, asking you invasive questions about how often you drink, how many drinks you normally consume, and even your withdrawal symptoms, because he has his own agenda and time constraints, and also fears stigmatizing you and disrupting his agenda with you during the visit. So, enter Beacon, our mobile tablet application that takes less than 4 minutes to complete and can be completed by the patient while sitting in the waiting room or at the time of taking vitals, and administered by a nurse or clinical staff member, saving the physician time. Beacon is comprised of 2 behavioral economic-driven decision-making tasks. They ask the patient first to make a decision between 2 choices around money and time. For example, would you rather have $500 today or $1,000 in 3 weeks? The second task asks patients to decide how many drinks they would purchase if they were offered at different price points. For example, how many drinks would you purchase if they were offered to you at 25 cents each? The next question might ask, how many would you purchase if they were $9 each? And with a total of 18 questions between these 2 tasks and taking less than 4 minutes to complete without asking a single question about how often you use alcohol or the number of drinks you normally consume, the clinician is output with a predictive risk evaluation of your alcohol use disorder and a simple evaluation of what to do next. This risk tool is preliminarily validated to map onto the gold standard metrics for alcohol screening used today in the clinic, like audit and DSM-5, which is the diagnostic criteria for alcohol use disorder. With this encouraging preliminary data, our go-to-market strategy is to continue our collaboration with Carilion Clinic and launch in 2020 and 2021. We then plan to expand regionally and launch at VCU and UVA, and then land a top national thought leader in translational research science at UPMC in Pittsburgh, Pennsylvania. What I'm showing you in this graph over the 5 years is the number of patient visits in millions. This is outpatient primary care visits cumulatively from all 4 of these institutions. If we translate these visits into dollars by multiplying by $4 per screen, which is the standardized, the price for standardized alcohol screening measures today, we would hit $33 million by 2024. Our team is uniquely suited to meet our success goals. Myself and Brent Kaplan are both research scientists in the lab of Dr. Warren Bickel at Virginia Tech Carilion Research Institute. Between Brent and myself, we have over nearly 20 years of research experience in substance abuse research, behavioral economics, and behavior analysis. Warren Bickel is an expert in behavioral economics and has more than 25 years of experience in substance abuse research and clinical trials. Our second senior scientific advisor, James McKillop, is also an expert in behavioral economics, is a co-inventor of the alcohol purchase task that I mentioned a moment ago, and is a clinical psychologist offering our team a clinical perspective as we develop our application. Our team's clinical expertise, paired with the business mentorship from RAMP, RBTC, and Cynthia Lawrence, offers our team a unique position to grow and grow fast. So I mentioned behavioral economics. That is the theory that's built Beam Diagnostics, and not only can predict the future of alcohol use disorder, but can predict risky decision-making and risky behaviors on a multiple scale level. We can predict alcohol use disorder. We can predict severity of opioid use disorder and also other drugs. Using this theory, we can also predict the risk of other medical negative behaviors like medical non-adherence, obesity and diabetes, and also risky sex. Outside of the medical industry, we can predict risky decision-making like irresponsible money management and gambling. And we can also predict risky behavior like risky driving, which could be translated into the trucking industry, and risky behavior like not wearing your safety gear on a construction site. If we take a look at our competitive landscape, our closest competitor for the Beacon app would be companies like NarcoCheck and Quest Diagnostics, which offer biological screening tools like blood tests and urine screens. These tests are validated and don't allow the patient to lie, per se. However, they require the patient to have recently used drugs or consumed alcohol to have a positive screen. In contrast, Beacon offers many benefits for translation into the healthcare system, including using app technology to reduce the time for the physician, their non-invasive questions, and most importantly, predicts future risk of alcohol use disorder. So where are we now? In July, we obtained a CIT grant fund to begin our process, and most recently we obtained a reward, a Phase 1 STTR Grant Fund Award for $300,000 from the National Institutes of Health to iterate our product, Beacon, based on clinician feedback of focus groups, and validate our tool in over 800 patients in the Carilion Clinic system, in the psychiatry, internal medicine, and family medicine departments. With these initial feasibility and acceptability trials, we plan to submit a Phase 2 application to NIH in 2019 for up to $1.5 million, which will allow us to validate our tool on a national scale and begin our FDA approval process, because this will be a medical device. In parallel, we've also been focused on alcohol use disorder. We recently submitted a Phase 1 application using the same technique and timeline to get a Phase 1 application for opioid use disorder tool, and that grant will be reviewed in November. As I mentioned, Beam Diagnostics is built on the concept that failure of self-control underlies a variety of negative health behaviors and decision-making domains. At this time, we're looking for partners and potential collaborators who could help us outside of the medical industry, particularly in risk mitigation fields like insurance agencies and human resource departments, to help us validate our tool in new markets. And with that, we're looking forward to speaking with you at the reception and talk with you about Beam's bright future. Thank you, and I'll take your questions.
Any questions for Sarah?
Yeah, Russ. Sure. So the questions, like I gave examples of, are asking questions like, how would you decide between money now or money later? And so it's hard for a patient to interpret what that's really getting at. But the theory behind behavioral economics actually helps us predict risk of alcohol use disorder just as well as those invasive questions would without asking them. Does that answer your question? Yes. But the real underlying niche is that the patient would not know how to answer to indicate that they're at risk for alcohol use or not. Yeah. Go ahead.
What are the savings to the insurance industry or society for mitigation of those?
That's a good question. I think it's huge. We're planning to, with our grant dollars, get an actual number from those things, but the hypothesis is that catching people on the front end saves the long-term cost way down the line. I mean, if you're catching alcohol use disorder on the front end before they end up in the ER or with liver disease, obviously they're much more expensive later on.
That
Right now, we see it as administer it to everyone in the primary care outpatient setting and catch everyone you can.
How does that feel in the privacy space? If I don't know, it's economic theory, and I don't know you're looking to see if I drink too much, how does that play?
So the data is HIPAA compliant, so the privacy is there. But it would the scores would be reviewed with the patient afterwards. So the doctor would take your scores and discuss with you. It's not a cloak and dagger type thing. It's just a tool for the doctors to use to get an assessment of how you're using alcohol and then go from there to bring up a discussion. Yes, we don't need internet connection to analyze the data. It'll all be contained in the medical system that it's integrated into. It's based on what's currently used, so it will be a reimbursable screen, and so per survey is just mapping onto what's currently done.
Okay, thank you, Sarah. So our next presenter is Corda Pharma. Unfortunately, Kelly Woolwine, their mentor, could not be here today, and so we've asked Lisa Garcia, one of our instructors in the educational portion of RAMP, to come up and introduce Rick.
Or I could scream. I could probably do that too.
Good afternoon, everybody. It's my distinct pleasure to introduce Dr. Rick Carlos of Corda Pharma. Rick and his team at Corda Pharma have created a topical cream to deal with pain associated with osteoarthritis. With more than 30 years of experience in research, education, and product development in pharmaceuticals, Rick is quite well poised to launch this company. I'm sure you'll be interested in hearing what he has to say, so please join me in welcoming Dr. Rick Carlos to the stage.
Well, thank you, Lisa. I'm Rick Carlos. I'm the founder and president of Corda Pharma, and we'd like to take a new drug to market. What we've developed is a novel and highly effective medication for the treatment of arthritis pain. Just a little bit about my bio. I have a doctorate in neurobiology, but I've spent most of my career in the pharmaceutical industry and specializing in pain management. I'm currently an assistant professor of pharmacology, and I have experience in the pharmaceutical industry as a chief scientific officer, QA, and regulatory affairs. Now, the problem that I want to address today, to bring your attention to, is that there is a big demand for new pain medications. This is driven in large part by a lack of efficacy, whether it's OTC compounds, which are notoriously ineffective, or some prescription compounds. There hasn't been a new, all-encompassing, widely used pain medication since probably gabapentin. As you know, opiate addiction is a huge problem in the United States. We do believe that we have a future drug, a future composition that will address this problem. The FDA also has issued several warnings just recently. They've black-boxed the drug Voltaren, which contains a non-steroidal anti-inflammatory drug called diclofenac. Voltaren really has been the go-to drug for osteoarthritis, leaving once again a major void in this particular treatment regime. And of course, aspirin, Tylenol, and the NSAIDs like Aleve, ibuprofen, all have side effect profiles. All are limited in use, and every osteoarthritis patient, or for that matter, neuropathic pain patients, have tried NSAIDs. There's a huge liability with NSAIDs, however. The probability of a bleed, a GI bleed, goes up with age. So 1 in about 2,000 to 1 in about 100 patients are going to suffer a GI bleed, which is unnoticeable during the course of therapy. As a result, the probability of dying from a GI bleed due to NSAID consumption also goes up proportionately with age. That's an indication of just how desperate some of these people are for new medications and just how much of a void there is for new medications. Now, the CDC has just recently come out with a study showing that the population of arthritis patients will increase as the overall population ages. The external analgesic market is increasing concomitantly with this. We're at about 800 million for the external analgesic market in 2017. And this translates, just for osteoarthritis alone, to about a $1.6 billion globally. And that's expected to increase over the next 8 to 10 years to about $3.5 billion globally, where most of that market is due to American consumption. Now, our product, we've targeted osteoarthritis for a large number of reasons, which I'll make clear as we go along. But we have this formulated now as a novel OTC, over-the-counter topical medication for arthritis. And you'll notice the knee, about 5 to 17% of all osteoarthritis patients in the United States have knee problems that result in osteoarthritis, even after surgery. That translates to about 50 million patients a year in the United States. What's our solution? Capsaicin. It's the hot ingredient of hot peppers. This is a pungent ingredient that peppers use to protect themselves against consumption. And if you bite into a hot pepper, your experience of that is that it really burns your mouth. It depends, of course, on the type of pepper, but the hot pepper, that capsaicin, paradoxically can act as an analgesia. It's just the same as poisons or venoms, which are highly toxic, but paradoxically also can produce analgesia. It's a wide area of research right now. I want to point out that there are only 2 species reckless enough to go around eating hot peppers. One is the humans, and another is a primate, a non-human primate called the tree shrew. This has a receptor for capsaicin, which is almost identical to the receptor in humans for capsaicin. However, it is mutated, which means that we can use this as a model for the development of new compounds. So what is our solution? Our solution is a non-burning capsaicin. What we've been able to do is to chemically modify the molecule in such a way that we retain the efficacy of the molecule and the safety, but we've shut down or very, very tightly limited the amount of burning that can occur with the consumption of this molecule. That means that we can increase the concentrations, i.e. we can increase the dose of capsaicin products, like an over-the-counter cream, to levels that become efficacious. Capsaicin is used for osteoarthritis and other forms of arthritis and other forms of pain, but it's just not very effective. And that's because of the dose limitation that goes along with burning. In fact, the FDA has just issued, not a black box, but has just issued a high-level warning against over-the-counter capsaicin creams due to the experience people have recently with burns. This will not burn. We've really kind of solved this problem. Now, what we would like to do in terms of our business model is a B2B plan, private labeling plan, where we'd like to do essentially wholesale distribution to geographically isolated retail outlets. One of the nice things about this kind of an approach is that we don't have to struggle and compete for shelf space. We'll get the shelf space. The branded products in the pain market actually constitutes a very large percentage, a large share. What this is showing you here are some of our competitors, but what it's showing you here are the unit sales. And what you can see here for private brands is that last year in 2017, private branding took about 11.5 million units, which is somewhere between Salon Pass and Icy Hot. Those are capsaicin products. They, along with capsaicin, this is the worst name for a product, you can hardly say it, high potency. These products have very low amounts of capsaicin. You can use them for arthritis, but they burn, and again, dose limitation really prevents the efficacy of these. And as I mentioned, the FDA has issued a warning on these kind of products. Our sales projections for the next 3 years are relatively modest. We're looking at $1.1 million of sales in 2019, 2020, $5.6 million, and in 2021, $15 million. Now, it's conservative because if you look at the market share that we expect, it's only from 0.1% to a little over 1% over the same time course. That's a very conservative estimate, but based on what we, based on the kind of unit sales that we think that we can get over the next 3 years, we think that this is realistic, if nothing else. But after the 4th year, pain patients look for new medications. They have blogs. They have community groups. We think after the 4th year, this is going to skyrocket. Our management team is very powerful. Locke Dow is an associate of mine that has come up with me through the pharmaceutical industry. He went off into the clinical supply work. I think a lot of startup companies sort of miss that a clinical supply expert is absolutely critical to keep the business going. So Locke and I will be primary in the company. My chemists are Alex Eaton. He got his degree at Virginia Tech, and William Huang, who I've known for almost 20 years. They're both good organic chemists. They're both good analytic chemists, and they are fundamental in the production of new compounds for the company. Our legal counsel is Beth Waller from Woods Rogers. I don't know where we'd be without her today. So shout out to her. Our accomplishments today, chemical synthesis work is all done. So investment does not require putting money into the R&D pocket, which is very deep and usually has a lot of holes in it. We are, in fact, ready for the market. We're ready to go to scale up. We're ready to do GMP commercial batches. We have an agreement that is in place with the 4th largest pharmaceutical company in China. I had given a sample of this to the CEO of the company, who gave it to his mother, who has rheumatoid arthritis, and she said, "You go out and get that compound." So he is under some family obligation to get this. Right now, we're just working out the finances. You can imagine how that must look. We have an agreement signed with a brokerage firm to start discussions with, again, retail outlets for white labeling. And then a pipeline. We have a provisional patent we're ready to submit probably at the end of the year. These are compounds based on our non-burning technology. They're all new chemical entities, and these are compounds that we believe will insert as relatively easy into the prescription market. And we have an SBIR application underway now. Our ask is $2 million over the next 24 months. What we would like to spend that money on is mostly for marketing, manufacturing, and some administrative costs. So in summary, we basically are looking at a multi-billion-dollar worldwide market for this product. It's completely new. You won't find it anywhere. It works. It's safe. And with that, I think we will change the way analgesia is done. And I think, as I said, there hasn't been a new analgesia since gabapentin in what was that, 1973. I think this will be a turning point in that industry. We have a great deal of competitive market research, which I'll be glad to share with you either at the reception or privately. So with that, I would like to thank Mary Miller. She had the insight to see that this company and its products are extraordinary, and I would like to thank her in particular for the chance here. Thank you very much.
Questions for Rick?
Sir? A great question. There's probably no good analgesic out there that doesn't have off-label use. The indication that we want is osteoarthritis because it is such a large market and because the literature is replete with capsation work and clinical trials. So that is the market we're targeting initially for our OTC products. But you're absolutely right. For rheumatoid arthritis, for neuropathic pain, for other forms of pain, post-traumatic surgery, one of the most valuable things right now is an appointment with an internist. And the reason for that is that the population is aging, and arthritis, other types of pain are becoming so ubiquitous in this population. Obesity is contributing to that too, that these appointments are becoming rare. So off-label use, other indications, it goes with all drugs. I gave you just some sales data or a perspective on just what we would expect with osteoarthritis for the first 3 years. But no, I mean, that market is going to, it's going to really balloon. Same thing has happened with gabapentin. Now the congener of gabapentin is Lyrica. Good question. Yes, sir? So if we have a white label and we're selling that to the store, they're going to put their label on it. And if they put their label on it, then they have a much wider profit margin for that. So they will push aside all of these other things, non-protected capsation probably, who knows, but they'll give us shelf space for that. Now we may have to do some significant marketing around that, but what's interesting about that is that, well, for good or bad, Facebook will allow some localized marketing, and we can use some of these online tools to target very specific local regions for that kind of marketing. Anything else? Yes, ma'am? Mm-hmm. Again, there's two components to that. One is our cost of goods, what it's going to cost us to make this. That's going to be a significant issue for us. Capsation is very expensive. What we're going to do is to have to put a premium product out there at a relatively higher price. So first of all, we're not going to try to undercut the prices. We've done a little bit of beta marketing, and that doesn't seem to be an issue. For pain patients, a lot of times the higher premium prices mean efficacy, and our Beta Marketing has indicated that that our patients have been extraordinarily pleased with this if reordering is a measure. Second of all, I think the branding that comes with Kroger's, Wegmans, H-E-B, and so forth, that is a local advertising issue. I think that we can focus our marketing dollar on those locations to a point where we can make the case that what we have here is something unique and new. And pain patients, as I pointed out, do seek out these new medications. So I think that's going to help drive our campaign. I think the localization of our campaign is going to help optimize our costs, our expenditures. And from that basis, that's the way I think we will make our products known to the public.
Thank you, Rick. Next, I'd like to welcome Mr. James McCadden up to the stage to talk about Leon BioVentures.
Yes, he is my older, wiser brother. No, he's not my son. Good afternoon. It's my pleasure this afternoon to introduce you to a rock star. You heard someone talk about Mark Lainoff as somebody we needed to attract and keep in the Valley. This young man is somebody we need to keep in the Valley, and we're going to do that. But let me tell you a little bit about Leon BioVentures. I'm not going to tell you much because that's his job. My job is just to introduce him. So, if I were to say the word fungus, most of you would probably immediately go to mushrooms, some really good ones, some really bad ones, and some that are deadly. When a farmer hears or sees fungus, it's usually pretty bad. It could be something that seriously reduces their crop. It could completely destroy their crop. Well, I'm happy to tell you that in a little small lab in a very nondescript building in downtown Roanoke, Virginia, there's some really big research going on. And that research is going to lead and has led and will continue to lead to the development of some very safe and naturally produced biopesticides that will help farmers literally around the world treat fungal diseases and increase their crop production. And the rock star guy that's doing that research in that little lab in Roanoke, Virginia is Josh James, COO of Leon BioVentures. Josh?
Thank you, Jim. Like Jim said, my name is Josh James. I'm the Chief Operating Officer of Leon BioVentures. At Leon BioVentures, we are training bacteria to produce a novel fungicide that will help solve many of the toughest problems in modern agriculture. Across the world today, pesticides have become a widespread part of the way that farmers are able to safely and effectively produce the crops that feed the world. While pesticide use has become widespread, the necessary technology and education to safely use pesticides has not yet followed suit. This picture here is of a woman working on a plantation in Thailand where she's spraying pesticides. If you look closely, you can see the only thing protecting her from the potentially harmful chemicals strapped to her back is a little plastic cape and her best judgment about how to safely use this sprayer. Unfortunately, practices like this are commonplace outside of the Western world and sometimes even in the Western world. As a result, we've started to see headlines like these. This first news article is talking about how workers on a plantation in Latin America have experienced infertility and cancer as a result of their exposure to pesticides. The second article takes place in India, where there have been widespread medical problems as a result of pesticide exposure for farmers. This has been a part of a much larger problem in India, which you may have heard of, called the suicide crisis for farmers, or the agrarian crisis, where many farmers have committed suicide as a result of feeling that they can't compete with the modern technologies that are being used and have thus turned to pesticides that they don't know how to control. This third article highlights the dangers even in better regulated countries like the US, where pesticides are still dangerous and people still need to treat them and use them with respect or risk huge health problems. At Leon BioVentures, we believe we have one part of the solution to this huge problem. Our solution is a set of antifungal agents called Burkholdines. Burkholdines are naturally produced by bacteria and thus much safer for humans to use. These Burkholdines have been proven to be effective against a wide variety of different agricultural fungal diseases in dozens of field trials. While we have not yet received any certification, we are confident that we will be able to sell our product for organic use. Now, I know what you might be thinking. Yes, it would be great if all the pesticides we use were safer and better for the environment, but organic pesticides just aren't as effective. This misconception comes from probably the biggest drawback of most organic fungicides. They don't effectively deal with a wide variety of different crop diseases. They're not broad spectrum. While Burkholdines are not 100% effective against all crop diseases, we do provide a significantly better crop disease coverage than most of our organic counterparts. We're also working right now on optimizing the way that Burkholdines are produced by the bacteria. This will allow us to efficiently and cheaply produce Burkholdines, whereas many organic fungicides are still produced by growing flowers and extracting chemicals from the pollen, which is incredibly costly to do. So during our time in RAMP, one of the biggest things we learned is that we need to go out and understand our market. And of course, during this process, we learned about things like other organic fungicides and chemical fungicides that we'll be competing with. But interestingly, we also learned about some of the other issues we might bump up against. You can see on the far side of the screen for me, this is a sleeve around the flower of a dragon fruit plant. This is what we would call a cultural control method. This is a simple, though relatively ineffective way that many farmers might employ to keep moisture levels on their plants down and thus prevent fungal disease. We will have to decide as a company as we go down the road whether we can compete with cheap but relatively ineffective methods like these. However, we are confident that we will be able to do so. We've been in talks with different people at USAID's Integrated Pest Management Program who actually helped to implement these sleeves in the first place, and they seemed very confident that upgrading from these plastic sleeves and other similar methods to our organic fungicide would be a huge benefit to these farmers, and they were passionate about helping us along in that process. I've already addressed some of how we plan to compete with other organic fungicides, both in broad spectrum efficacy and in production costs, so we'll move on to chemical pesticides. Right now, our desire is not to compete in the chemical pesticide market. We learned when doing our research that the needs there are very, very different, and unless we can compete directly on cost, we do not plan to enter that market at this time. Right now, in our development plan, we are in what you could call the optimization phase. We know that Burkholdines can be an effective pesticide for agricultural use. We still have to prove that we can efficiently and effectively produce them the way we want to. That's what I'm working on in our lab right now. Once we complete that, we will move on to a small-scale fermentation phase where we'll grow just a sample size of what we're creating for testing. Then we'll work on formulating our product and conducting even more field trials to prove our broad-spectrum efficacy. Once those things are completed, we begin the EPA approval process. Now, we don't ever plan to reach the point where we would open a large-scale fermentation facility and directly market and sell our product. Instead, our plan is to partner with existing biopesticide companies like MGK, Syngenta, or Bayer. Our hope is that we can partner with these companies to help us advance our development process and tackle some of the more complicated steps. Once we've completed that, we would license our technology back to one of these companies for them to produce and sell using their existing infrastructure. Right now, our team consists of our founder and president, Edward Goyette, myself, and our consulting scientist, Dr. Falkenham. Edward has tremendous experience in the biotech industry running a successful company here in Roanoke called American Biosystems. He's an experienced entrepreneur and understands the ag tech space well. I bring my background and experience as a researcher and bioengineer to focus on tackling our optimization focus. I'm working in the lab almost every day to help train these bacteria to produce our product more efficiently. Dr. Falkenham has been enormous help to us during this process. He's the world's leading expert on Burkholdeans and the bacteria that produce them naturally. He has provided us significant insight on the best ways to guide this product towards success. We've also received incredible help from Edwards' flagship company, American Biosystems, who've provided for most of our financial needs thus far. We've also received tremendous help from our mentor, Jim McCadden, and also from Mary Miller, who has connected us with a lot of people in this space already. Moving forward, we're looking to connect with even more people in the biotech space, particularly those with specialties in biopesticides. So if you know or have connections in that area, I would love to talk to you about that during the reception. We are in the unusual but fortunate position of not needing any money right now, but in 12 to 18 months, we will begin raising the $2 to $5 million that it will require for us to complete our EPA approval process. We're very excited about everything that's going well for us here at Leon BioVentures, and I'm grateful for the opportunity to share all that with you. Thank you.
Questions? Come on, nobody's going to ask how you train bacteria.
Yeah, so we are fortunate because our product is naturally produced. We actually go through a much shorter EPA approval process than most pesticides would. To register a conventional pesticide, you're looking at 10 to 15 years and tens of millions of dollars to complete that process. For us, it's probably closer to 1.5 to 3 years, and that $2 to $4 million is about what we would expect that to cost for us. And then most of what they need in terms of completing that information we're completing along the way to get there. Mm-hmm. Yeah, that's a great question. Can I actually get back on my PowerPoint because I have an extra slide about this?
We can try.
Yeah, I'd appreciate that. So one of the big things, and if any of you have heard me pitch before, one of the things we've talked about in the past is bananas. And I didn't really focus on that in this presentation because we're now thinking that being a broad spectrum fungicide is an even more appealing aspect of this. But we do know that there is big problems with the banana industry right now. They're experiencing a lot of untreated fungal issues. And I think we're about to see, this is just a sampling of the field trials that have been conducted with our fungicides. So you can see we got really good numbers on rice, geraniums, peppers, wheat, peanuts, tomatoes, grapes. So these are just probably like the first 10 that I picked off the top of the list. I think there's about 70 of these that have been completed. But once we get farther along our path, we're going to conduct even more field trials and hopefully show that this can really be the broad spectrum efficacy that fungicides have been lacking for a long time. Yes, so a lot of our field trials, like I said, are already done, which puts us a little bit of a leg up on that. Typically what you would do for a field trial is we would be giving samples of our pesticide to a university that has either a greenhouse or a field lab, if you will, and they're going to test that and provide results back to us. We want all of that data to be unbiased so that we can't just go to a company and say, hey, we tested our product, look how well it did, and them not believe us. But a lot of that's done for us already, and even some of these companies we've talked to have indicated that they do some of this on their own, that if they're going to buy into a product and take a license on it, they may even just ask for samples of what we have, conduct their own field trials, and give us the results after that. Any other questions? Yes. So that would be something more in our formulation phase. Right now, the field trials have been done just with what's called a spray-dried powder. So we took the bacteria, dried it out. The compound itself, the Burkholdeans, are heat stable. So you can just dry out the cells and spray that, and it works effectively. But in order to actually sell, we would formulate the product. That means like adding things like oils and emulsifiers and different basically additives to our compound to make sure it'd stick to things. And that's really where you get into all these other conditions. Most of that is affected by formulation. How well did you put your product together so it can work well in different conditions? But we will eventually get to that.
Thank you so much, Josh. Next, I'd like to welcome Ken Ferris to the stage to introduce Elliot McAllister.
Good afternoon. It's indeed a privilege for me to introduce Elliot to you. I've been working with him along with Jeff McCarty. I won't ask him to come up here again. With Elliot for the past 4 months. Jeff and I complement each other well. He knows, I don't know much about marketing, and he knows everything about marketing. Elliot has a BS in mechanical engineering from the University of New Hampshire, a master's in material science from Virginia Tech. After completing that, he entered a materials PhD program at Virginia Tech. And after he finished all of his coursework, he decided to leave and go full-time into pursuing a passion that he had developed during his PhD work of 3D printing of novel devices. He started Skyphos Technologies September a year ago, and in the past 12 months has developed a fully functioning prototype. Generally, people look at a very interesting startup as one that has major disruption in either capability, cost, or improvement of an important process. Skyphos Technologies has, their technology is disruptive in all three of these arenas. So I'll let Elliot come and tell you all about it. Elliot?
Hi, everyone. Thanks. That was a great introduction. Medicine and science can fail at any time. It would be my personal preference if it would just keep all those failures in the lab and not when you're about to launch a brand new breakthrough point of care to somebody's bedside. But that's exactly where we find ourselves today. More and more often, the tools that we use to make our medical devices are failing us at the end of the lab before we get to manufacturing. And there's nobody there with a safety net to tell you that it's about to happen. How can this be? I'm Elliot McAllister, and I started Skyphos Technologies. Over the last 12 months, we've developed a 3D printing process that is disruptive to the industry because it attacks this 30-year-old process that we've been developing with that was originally designed to make computer chips, not for microfluidics. And I know that everybody here doesn't know about microfluidics, so we're going to get your PhD right now. You pick up diplomas on the way out. Microfluidic chips are important because they are used as a development tool for many of our important drugs that are coming out, any of our point of care and our diagnostics. They are the throughput, the conduit that is going to get us to the next level for medical devices. So at the top here, we can see there's 3 different chips. From left to right, there's a lot of things that are similar and a couple things that are different. Right away, we can see that they're all clear, they've got holes, they've got channels on them. Those channels are about the size of a human hair, okay? About 100 microns. Those ports on them and those colors, those are different reagents and those are different biologicals that we run to test and to find our targets or to tell us something about what's going on with the patient. We can see that the middle one there looks the most like a computer chip, and that's because it uses this lithographic process. And all the way on the right there, that guy looks really imposing. He's got about 60 ports and connections. He's underneath a microscope slide, and he's in some kind of box that's holding him there. These chips can get so complex and so rapidly get so complex that it can be difficult to handle them. In fact, the one on the right probably runs not only electricity, but also liquids and gases at the same time. If you know anything about electricity and fluids, they're not supposed to be anywhere close to each other. So this is a big problem, right? But these chips bring us a lot of, make our lives a lot easier. For example, people here probably know about diabetes testing, the glucose monitoring.
The one that I'm most excited about that's coming out recently is a strep test. So my 3 hobbits at home, I don't have to interrupt them in the middle and bring them all to the doctor's office when one of them has a sore throat. Now I can go to Walgreens, pick up a package off the shelf, and in 5 minutes call my doctor and tell him that I need medication. At the bottom here, we're looking at the market, okay? Point of care, diagnostics, drug testing, 8.4 billion worldwide. Below that, we can see I had chemical yes and chemical no. This was the easy way to bring in immunochemistry, right? Whether or not we're using an antigen to test for something and tell us a target, like, for example, a pregnancy test. So we can split the market into 2 segments. We at Skyfos are directly targeting the one that does not use the chemical currently. Doesn't mean we can't do the other one, but that's not our market right now. Below that, I split it out into materials that are used for all these chips. Okay. Typically these chips, as you see, most of these are clear. There is one that's not, that's a silicon wafer. But generally, Skyfos can directly target the glass and the polymers. That's because we now possess the technology to get down to the level where we need to, as far as the feature sizes and the resolution. So I was saying before that there's a problem with this manufacturing. You get a lab, and all of a sudden, oops, you fall off the stage, and you're not going to get on the market. So let's talk about that problem, okay? What we have is a technology void, and the process that we use, that we move our ideas from the lab to market, is a train wreck. Start in the center box here. Everybody from the lab will take their drawing and they'll send it to a wafer manufacturer. That's the silicon mold, okay? Generally speaking, that takes 6 weeks and about $1,500 for you to get that mold back to your lab. Then you're going to move down to the bottom blue circle. That's where you're going to pour a polymer into that master to make your device. You'll peel that off the master and stick it onto a slide, put some ports in it. Then your test, okay? That generally will take you about 2 hours if you're really good, but in many of these devices, because they're complicated and multi-layered like a sandwich, it takes up to several days to figure out how to make that device the first time, and can take up to 6 to 8 hours to make it once you're really good, with still a 50% failure rate. That means when I have a PhD working on this, it's going to take them 1 week and I get 2 chips to test. That is no way to go about doing research. Now, if the unforeseen happens and I actually make it and something works out, I'll go back to silicon mold manufacturer about 3 to 5 more times, which means it takes me a year of development to make sure my test is good enough. Now, out of that year, if each time I go back to the silicon mold maker and it's 6 weeks, I've been only testing for 2 months out of 12. If I have an NIH grant or an NSF grant, that means that all my money is wrapped up into waiting for this to happen. That can't possibly be. I need this to happen faster for me. Now let's get even weirder. I actually make it and the device works. Now it gets really crazy because now I got to go up to the top of the screen here and I got to wait 4 months and do a whole bunch more testing to get to hot embossing because the way that I've been doing it in the lab isn't fast enough. I can't get enough of these devices out to people. I can't do clinical testing because I can't make them fast enough. Hot embossing or liquid injection molding, those are the 2 processes to do it. But now I've changed materials. It's nuts. Let me get a little bit deeper into the process. Part of all of these expenses for making a silicon wafer come from the infrastructure built into that system. This guy here, all the way in the top left, he's pretty expensive. He's got a lot of laundry because every day he puts on that white gown, goes into that clean room. I got to pay for his insurance. I got to pay for the HVAC system, the corrosive chemicals they use in there, and it looks like he's got an assistant who also likes to dress in white. Further on, manual assembly. When I said this comes back to my lab, my PhD student, she's got to manually assemble each of these chips. Now, 1 layer might not be a big deal to stick it down on top of a glass slide and put a couple holes in it for all of your fluids. But usually, like I said, we're dealing with 2 to 4 layers. And these feature sizes are on the size of 100 microns of human hair. So she's doing it under a microscope with her hands. We have a strict rule, no coffee after 10 a.m. Finally, on the bottom, let's talk about the fact that these are flexible polymers, right? In general, that can be a good thing for making a mold because you can get them off easy. But it wreaks havoc when you're trying to deal with throughput. Usually we'd like to build these chips high enough that we can get enough throughput through, because if they take too long to get all of our fluid through, you can actually end up killing your target or not even having a target there for you. The problem here at the bottom, the aspect ratio is too tall. We've built these pillars too tall and they've fallen on top of each other and collapsed. This is now a dead area in the chip. It's no longer active. It's either giving me bad data or no data, which is even worse because now I spent 6 hours building this and I can't even use it. So as I said, the solution we developed was 3D printing. It turns out that vat polymerization 3D printers are the perfect method to change a little bit to get it to work. So where did we end up with this whole paradigm here? There we go. We ended up at the nirvana for chip manufacturing. Okay, we can make chips in our lab from a drawing, anybody's drawing, three-dimensionally in 15 to 20 minutes. Further, every single chip that comes off, you know exactly how much it's going to cost you. These big bubbles, the reason that they're so huge, hot embossing and silicon wafer, that's because the range of how expensive they will be depends on how complex your device is. That's no longer needed. We can pinpoint exactly how much that's going to be, how much it's going to cost you just by the volume of the size of the chip. That's because 3D printing doesn't care about the rest of those things. This means that we have now introduced a new paradigm into this science. Agile development. Just like in computer programming, where you can do bits and pieces of the different program at the same time and then communicate them together, we now have reduced this cycle time so much that we can develop what used to take 8 weeks, we compressed that down into 3. So with an 8-week cycle time, one cycle, we can now do 3 cycles in 9 weeks. That means that that 12-month period that you used to develop that first device can now take 3.5 months. Your first chip comes off in a week, you're testing them. Your chips cost you $1,000 instead of $10,000. And it's innately flexible because we don't need molds. But let me tell you about what else we solved. With 3D printing, there was a limit that you could hit. The smaller you shrunk the pixels down, the smaller the size of the object you could print was. But what we did was we decoupled that pixel size from how small or how big the image was that you could make. This means you have massive surface areas now inside of a chip, which is where all the magic happens on microfluidics. That internal surface area, the sides of the chambers, the areas around the pillars, that's where the interactions happen with your targets and your cells. And so now, because we can build so much taller, we can build 10 times the aspect ratios that we could before. So we have 10 times at least the internal surface areas. And that's not even pushing this that far. Our prototype is our production. Remember I said we had to go back and we had to do this other hot embossing? We don't have to do that anymore because the material that we're using for your prototype is exactly the same one that you're going to be using for your production model. So when you get that first chip, that chip is going to act the same exact way that your production model will. We have plug-and-play porting. Those 60 different connections on that first slide, the really complex chip, those are all done by hand. That's how we do it in the lab. And it's really hard to make a connection like that when you've got them that small. So you've got to have some kind of manifold to connect it. And usually when you scale up and do it at a large scale, you have to have the ports far enough away that they won't interfere with each other. But with 3D printing, we can build those directly into the chip. And finally, automated layering, because we really like to have coffee earlier than 10 in the morning. This chip here on the left is an example. The reason that it's blurry is because those pillars are 200 microns tall and it goes out of range of the microscope focal plane. Okay, so I know that it looks blurry, but it's actually blurry because it's a really big accomplishment. We can't do that with lithography right now. So we have a really robust intellectual property portfolio. We've developed one that is already patent pending. We have 2 more in the hopper that are probably going to turn into 5 or 7 more, I'm told from my patent attorney, and I'm not sure if he also wants to be my banker. So we've covered optics and mechanics, we've covered software and hardware, and we're even starting to get into the development of the actual fabrication of the chips and trying to get patents on those. This is our revenue model for what we foresee in the next 4 years. We will be cash positive in 2020 and growing to about a $5 million EBITDA at the end of 2023, which gives us, in our industry, a 15 to 27x multiplier, about $60 million. I've broken this out into 3 distinct categories, okay, because we're first doing fabrication of chips for our clients. The next thing is that we will launch a printer and materials for those printers the year following. The reason for that is because this process is so easy now, people will want to bring that in-house. They won't want to outsource this in the future. And we're foreseeing that in the market. We've seen it already happen with other 3D printers. In summary, we're uniquely qualified for this job now. We have the best printing process in the world for this. It's the fastest, and our customers are adopting us. In fact, I'm announcing that we have 2 customers today. We have a third one that may be on the line. And I might have to go back and redo the revenue slide, because as soon as you have data, when you're proposing something and you don't have any data, and then you have data, you have to go back and fish things out. We have robust intellectual property, and our business model has already been validated by several other rapid prototyping systems out there like Proto Labs, Sculptio, and 3D Hubs. Finally, our ask for today is that we're looking for just over $500,000 for funding for the next 24 months. This will be done in 2 tranches, the first one for $250K, and this is the split up over the next 24 months. I'll hold it there and ask for questions.
Questions for Elliot?
The materials for the printers? We're manufacturing microchips. We developed a printer in-house, and so we build the printers in-house. We also developed our own proprietary resins, and those are also kept in-house. Right. So for vat polymerization, you'll use a resin. It's a liquid. It's got the viscosity a little bit lighter than honey, or like a motor oil, and you pour it into a vat and you use light to solidify it. Right. Right. So that was the first slide. So to make microchips for computers, they also use this exact same process, this lithographic process. And so that works wonderful for computer chips, but for fluidics, it's a horrible process because you don't need all that other stuff. You need a plastic chip, and so to make it out of silicon and then jump through all these other hoops can become quite tedious.
You're expecting lab send documents to you that you can introduce to your fabrication services, some of the chips that they want. I didn't see any plans to add personnel to do that. So even though you've got the 3D printer, there's got to be some throughput through there, and I'm sure you're going to have to invest something deep early on. What are your plans for that?
Right. So right now, well, over the summer, I'm going to step back so I'm not in the zone here. Over the summer, we had a brilliant programmer who's going to UVA right now, Sam Welch. Hopefully, I'll be able to get him back after this year as well when he completes his studies. We also are looking at business development and hiring 2 technicians over the next year. At the end of this year, I expect to have 1 dedicated salesperson.
And as you do that, you will have to build more 3D printers, right?
Yeah. Yeah, so looking at the demand from our forecast, it looks like we'd need about 11 3D printers by the end of year 4. They are really fast. So the process cycle time for these typical chips, when you get to a high throughput, the hot embossing style, it's typically about 15 minutes, 8 to 15 minutes per chip. On our 3D printer, it's between 1 and 4 minutes. So how long it is?
Yeah, and just what the steps are, what do you have to do to convince them to sell?
Sure. So the customers we actually have were generated actually because of RAMP. So we went out and did customer discovery, and that customer discovery was not a sales call. It was an information call. It was, what is your problem? What are your pains? What do you want to solve? And so they got to know us, and then they sort of got a little bit smart, and they said, what are you working on? And so they'd check in, and we said, well, we'll give you a call when we're ready to talk about what we're working on, but we'd love to talk with you some more. So when we unveiled what we were working on and what we could do, it was not a hard switch because we knew everything that they wanted, right? And we were sort of ahead of the curve because I had been in it for so long and knew what my pains were as theirs would be. As far as getting a customer, it's quite simple. We take this exact same process they use currently, where they submit a drawing. You go through basically a 15 to 30-minute phone call just to make sure you have tolerances correct and if there's anything that pops up on your end. And then they can place an order. It's as simple as they can order a minimum quantity of 10, or they can go up from there. If they go up above a certain level, we'll talk about a subscription service where we send out a portion of their order.
And the chips I see are consumable for which they're in the lab and used one time and testing into.
Pretty much. So in the lab, sometimes if you're working with a cell line, they can be used multiple times, but you'll basically get rid of that chip at the end of the day. Of course, in clinical trials, you'll use it one chip, one patient, and it is a consumable in either case.
Thank you, Elliot.
All right, thanks, guys.